I think for me, first of all, articulating the campaign just as we have done it, that it is possible for a child to be born HIV positive, is HIV free, is actually the first issue. The second issue is that we are so caught up in things that cannot work. You know, it's incurable, you know, the medicines are expensive, but for the first time we have a campaign that we can all rally around where we actually can do something. When I'm in Kenya, I have several things that I can do. I lobby governments to increase funding. I work with partners to make sure that pediatric HIV is in the Global Fund proposal. I look at the gender aspects of making sure that rollout of a program can take place. I make sure that women's programs, even if it's looking at empowerment, will assist for caretaking to be done for children, like you can leave your child with someone in order to go and give birth at the clinic. I also look at, are there voucher schemes for women to be able to go and give birth that do not rely on them having money on the pocket to get there. So for the first time, this is a campaign I know that there are things tangibly I can do to be able to succeed. It is not abstract, it is not distant, it is not difficult, but it is challenging. Obviously, it requires a lot of rallying and a lot of discussion. So the campaign, one of the reasons why it has caught flame in the 6 countries is because we all can see how we can fit into the campaign. I know that I can contribute. I know that even if I do my own small thing, which is the power that I have to lobby governments, because I've worked in policy all my life, and I'm an advocate and I'm a strong speaker, I know that's something that I can be able to do, and that's a commitment that I bring to the council.
To stimulate demand, to push as many of our mothers as possible to enroll for antenatal care at least 4 times during the course of the pregnancy. To demystify antenatal care, because some traditionalists still believe that no, we can do it at home the way our grandmothers used to do it. But above all, also the involvement of men, because CEPA has a family-centered approach, and it is important that the men who are jointly responsible for the children, they should also come on board and be tested for HIV, and also to ensure that they help to create the necessary environment at home free from stigma, supporting their wives and their children to adhere to treatment, but also to be free to disclose their results after HIV testing, because there are instances of domestic violence after disclosure of positive results. But also, I think that our governments need to invest more in the HIV/AIDS response, particularly pediatric care and treatment, and PMTCT, to ensure that we have the necessary resources, that the system is working, to ensure that the logistical requirements are in place, the drugs are in place, the health workers are in place, to make sure that we have children that are born free of HIV in our countries.
I believe the media, first of all, has got to understand what it is that we are facing when it comes to children living with HIV/AIDS, and they've also got to be partners in all this, in every campaign that takes place. They shouldn't be just invited to come and do coverage, but they should be able to partner with all, either be it CEPA, be it UNICEF, be it the Ministry of Health in our countries, to understand that this is what we have in hands, and that we should remember that the future generation are the children, and we owe it to these children, to these innocent children who are born with this disease, not knowing why did it have to happen to me? I didn't do anything wrong. So once we are informed as media what you're supposed to do, I'm sure we'll be able to participate and play our role properly.
The top priority in this campaign to end pediatric AIDS, I think, is to get everybody on board. We need to get the population themselves, the families, who are the mothers and the fathers who need to access the prevention methods to be part of this campaign. We need the community at large to be part of this campaign, the health workers and the government leaders as well.
We need donor support. We can do a lot, but as I said, the government must take the leadership. Secondly, we need the support from donors. If not, it will be chaotic like seems to be now in Mozambique. We have problems with drugs. We start to treat. Now, it's possible that in next months, people who start the treatment do not have the proper medicines to continue it. Second is to guarantee proper treatments. The adherence is another important problem. You can start, you can treat thousands of people, but if you not are able to guarantee that all the structures work and to follow this treatment, involving the family, involving the community, it will be a failure. Like in Mozambique, the Minister of Health talking about 180,000 people in treatment. I can say they start treatment, but which is the amount of them which really take every day, and probably less than 50%, which can cause another problem in the future. Drugs is important, but the access, the long distance that people need to take the tablets, the medicines, is terrible. And the price of this is not included on their own budget. I can say most of the people also in Maputo city, is the capital, to take the tablets for 1 month, they need an extra amount of $1 or $2 to go home to the health facility to take the tablets. Last month, they need to take 4 times, 5 times, because the shortage of medicines, they're going to go weekly to take. You can imagine what this mean in their pocket money.
The top priority is to have our government respond positively to what they have committed themselves. They should play their part by providing at least 15% of the healthcare that they committed to. And for everybody else in that country, including the government officials, the CSOs, the partners, and everybody, including the individuals, to take their part, to do their part, to make sure that all the facilities are available to have the children receive the proper care after birth.
The topmost priority is adequate resources. We need adequate resources to go towards treatment of HIV-infected mothers. Prevention of parent to child transmission of HIV is going to be a priority. And priority number 2 is to increase treatment of those children who are currently infected with HIV, to make sure that we cut on the flood, we don't get more children being infected, while those who are infected are getting the best possible treatment so that they become productive members of society and that they grow up well without AIDS.